Are you looking to hire an associate dentist to unlock more freedom, free time, and best of all, fewer hygiene checks? My name is Paul, Dr. Nacho Goodman, founder of Dentist Job Connect and Dental Nachos. And at Dentist Job Connect, we help bond you together with an awesome associate dentist. And if you're looking for an amazing job, we help you with that too. Just text hire to 215-798-9897. Text hire to 215-798-9897 or visit us at dentistjobconnect.com. I am also a multiple practice owner, so I know the fun and frustrations of running a dental group. And one of the things that we do on this show is introduce you to amazing people doing amazing things who can help us do the three things we stand for: increase success, decrease stress, and most of all, reduce the number of times we feel like crying inside a day. So I'd like to welcome my special guest. Please introduce yourself to our audience and tell us a little about yourself.
Thank you so much, Paul. And my name is Dr. Marc Liechtung. I'm a dentist for the last, I would say, 35, 36 years. It's been a great ride. I've invented a product called Snap-on Smile. I practiced in New York City, and now I'm part of the group world of, as you say, multiple ownership or multi-practice ownership. And I really see tremendous successes in the future. I know we've gone through a couple of tough years with all the monies and the interest rates and whatnot, but right now I think we're on for some, hopefully, we all have to be optimistic, some positive growth and some positive exits for those that are looking for it.
Thanks for sharing that. I want to thank you personally because I use the Snap-on Smile for a patient to help temporize implants. Tell us about the Snap-on Smile and the story behind that invention.
Yeah, I have a large practice in Lincoln Center, and very good associates, did a lot of cases, and we did a lot of great treatment planning. And it always upset me that people couldn't afford it. We talk about third-party finance. It doesn't matter. You can't get water from a stone, and people do have a lot of things going on in life. So one day, real quick, Sunday morning, it was a average Sunday morning in New York City. I get a call from my father, may he rest in peace. He said, your grandmother, we called her Bubby, but your grandmother, her roommate in her nursing home, threw her partials down the incinerator.
Oh,
And it
wow.
was a serious problem. My grandmother at the time was 94 years old. She was devastated, and my father told me, you got to go in. He's in business. He's not in the dental field. Said, you got to go there and put some teeth in her head. I said, Dad, we don't. And he goes, I don't care what you do. She is crying. So I had my assistant pack up a box for me, with me in the city, and I drove to Williamsburg, Brooklyn, and I spent 8 hours carving thank God for pen training, a
Yeah.
block carved full arch, upper
Wow.
and lower, to the best of my ability. And as I'm coming home, I'm saying we should, in dentistry, in this generation, have something that could go and just suffice for a year, 2 years, a month, temporaries, but something that is less invasive and something most people, if not all people, can say yes to. I always thank God for my grandmother and that incident, but that is how it born out the idea of Snap-on Smile.
Well, it helped me personally with one of my patients for an implant temporary. People get frustrated with some of those
Yeah.
removables, and I really appreciate that you invented this. Now, the world now, it's 2025, and the whole world of DSOs, DPOs has evolved over time. Kind of tell us
Absolutely.
about your journey with selling a practice, then buying it back.
Right.
Sounds exciting. Dentists love drama. You know us dentists, we
Yeah,
love
I
drama.
love that.
So
You
tell us
know,
about this story.
yeah. And I know, first of all, I want to thank all of you for having me here because this is a tremendous opportunity for dentists around the country to learn so much. And Paul, having this brief chance to get to know you a little bit, very little, but I'm blown away by your commitment to keeping
Thanks.
this light and very knowledgeable, and I love it.
Appreciate that.
Yeah, thank you. I was a practice owner in New York. I always loved the business end because I guess it was in my blood. I came from a business family, and I do believe, and you're one I could say this to, having a couple of bites at the dental apple always helps. You
Yeah.
see it in different light. You see manufacturers, you meet some kings. And I was plugging along Lincoln Center, building a $4 or $5 million practice. Believe me, taking out a lot of money and not looking past thanking God and my team that we were building this practice. And all of a sudden, somebody from Dental Care Alliance, their chief clinician who I was friendly with and I really have a lot of respect for. And I guess if I say that, I could say his name, Dr. Craig Abramowitz. But I don't
Yeah.
want you to think he was the judge and jury on buying a practice. He was somebody I could relate to. Well, they came in and made me an amazing offer at the time of life when dental practices weren't bought on EBITDA, they were bought on percentages of gross. So
Yeah.
they paid me over 110% of gross, $4.9 million practice. That's a lot of change for a guy who's drilling teeth. And we all know that. So I sold the business. And I do believe that in all successes, if you believe in God or you believe in faith, you have to believe in something that happens for some unbelievable reason. And I think if you do the right thing and you do the right thing, whether it be for your employees, patients, but also your own loving family and friends, obviously, I do believe it comes back to you. And I sold this practice. Money was great. And 2 years later, I get the reports because I still had some interest in the money flow, which was such BS at the time. Make a long story endless. I bought it from the practice. They bought my practice. 2 years later, they took it and tanked it. They needed to get out. I told them I'll buy it. I offered them 475,000, and they took it. It was 8% of what they paid me, and I built it up again and sold it to another group. And I think that I don't walk around thinking that that was me doing it. It was really me just being in the place to take good opportunities, make it work. That's really what it is.
If I could ask you a question about that
Please.
experience, after partnering with DCA, and then you said over that 2 years, it didn't go as well as they had hoped.
Right.
What if somebody's listening saying, I might be thinking collaborating with the DSO or DPO, what are some watch out factors? Like, hey,
Right.
they
Yep.
changed my team or they changed my lab. And that might not have been the thing, but give our audience a few, just watch out for this if you
Right.
decide to transition your practice. And that could be to a private practice dentist or a DSO or DPO.
Correct. That's a great question. And I'll tell you this. What happened years ago was, we went through a transformation as an industry. Back then, at that time, like I said, they were buying top line revenue. EBITDA wasn't a big deal. And they truly believed that Dr. Marc Liechtung or Dr. John Doe or Dr. James Smith or Jane Doe can produce and they can get somebody in there to replace you.
Yeah.
I think what's happened in the group markets is they cannot replace us. They have realized that some of us, most of us that have all of us that have built these practices are valuable. And I believe that they disregarded that and disregarded some of the guys in work and gals who were working for me that were top producers. And in the end, they learned a very, very valuable lesson to treat the doctor. And now, to your point, now I find groups wanting us to stay longer, putting tougher contracts that they can't just let us go, or they want us to be more involved. So I do believe that they got the message, but that is a factor of them not regarding the dentist and the team as much as they should.
I love that. I mean, not all dentists and teams are created equal, just like not all running backs. I mean, I can bring up Saquon Barkley at this
Oh,
time,
here
the
we go.
Eagles
Thank you
Super
for
Bowl
hurting
win.
me,
Yeah, yeah, yeah. So I'll
you
bring that
little
up.
thing.
Yeah. So now to kind of switch gears to something I love talking
Yeah,
about, general dentists traditionally will refer out procedures like root canals, extractions, and implants. I did a multiple year GPR where I got very involved with doing implant dentistry, and I loved keeping that in our practice in a responsible way. Kind of tell me why you believe more GPs should keep work like this in their practice.
yeah. Many reasons, but one really important reason is you keep your dentists. Young dentists today want to do multiple modalities. Really entrepreneurial young dentists that come out and want to make this a great profession. They want to do implants like you do. They want to do surgical extraction and bone grafts like we do. They want to do endo but they also want to put crowns on teeth. And clear aligners today are easy. So because you're just getting it done by an orthodontist out of the office. To me, general dentistry has become multiple procedurally dentistry and super generalist. Why? Obvious reason is funding. I mean, the finances. You keep so much more, you produce more, you're happy, you go home fulfilled. But more importantly, think of your comprehensive treatment planning. If you don't do everything, and case in point, on any case, you could see an associate, if they could remove a tooth and not do a root canal, they're going to do it. If they could do a bridge and not do an implant, they could do it. But today, I believe that dentists that are fully educated in those procedures, right? That I have a dental hamsa, a hand that goes clear align, root canal, clear aligners, crown and bridge cosmetics, extractions, and implants. You're comprehensive treatment planning everything. That's why it's important.
I couldn't agree with you more. The and I want to say is I allowed to say a lot of times I say and not but. So I'll say and not but. Where would you guide them into getting this training? Many dental schools are not delivering an adequate clinical experience. Many dental schools are taking more dental students than they have enough patients for them to see. I mean, more students and not enough patients. So let's say you're a motivated young dentist right out of school and you say, I want to learn about clear aligners, but I don't know anything about ortho. Kind of guide me into where you would tell them to go.
Well, let's face it, today the vendor world is so in tune in training dentists. First thing, I would look in the mirror and ask, what do you like to do? And what could you see yourself doing for the next 25 years? If it's oral medicine diagnosis, go teach. But if you want to be a great dentist, a dentist that produces a lot and does great work, I believe the first end you have to start is surgery. You have to be
I agree
comfortable
with you.
with taking teeth out, modifying bone ridges, putting grafts, bone grafts and membranes in, and doing implants. Because from there, everything builds out. You have to look at it back in the perio days. From perio bores out your restorative. Well, this from the implants and the bone bears out your knowledge because doing crowns, it's going to become second nature. Doing root canals, you're going to have to get better. Clear aligners, they have vendors that do it for you and they'll train you as you go. But the surgery, you need to adapt to it and want it. You said, Paul, you said, I love implant. Well, that's the game. The game is if you love that stuff, then you can really do more expansive cases and be really so much
You
more
know why I
fulfilled,
loved it?
in my opinion.
You know why I
What's that?
loved it? No, I loved it, Mark, because patients don't complain about the color of the implant in the bone. They can't see it. And I say this as a joke, but a meaningful. There's so much stress with the stuff people can see with their smile. I always say there's only two types of dentistry: stuff patients can see and can't see, right? Stuff patients and when you get into removing teeth, I was just on a webinar with dental students. I said, learn to extract as many teeth as possible. You will be valuable to as an associate dentist, you'll be valuable to your team. So that is such great advice.
But
And
I got to tell you
I
something.
find, go
I
ahead.
want to add one thing to that, and that is triage or emergency dentistry. If we can't get people out of pain on every angle, we are not fulfilling our license, in my opinion. We have to be able to take a tooth out. I'm not talking about drilling bone away and taking it. I'm talking about a broken number 28. You have to be able to trough and elevate. And I'm saying from that goes implants. But you must be able to do pulpotomies and root canals and extractions and bear out your practice and grow it from emergency, at least emergency dentistry. From there, you can grow if you want to do implants, restorative, all-on-X's, great. But I've got some general dentists that are doing amazing work, and they've made me believe it.
I totally agree with you. And the thing I'd like to reinforce is you talked about return on investment, and many people think that that is just money. What I say return on investment is the relationships, the opportunities, and the impact we get to have on others. And that's the real ROI. And you do that with your patients and team because you're someone who's grown a group. And I'm going to guess that as you age in dentistry, you might not feel like taking out as many teeth. So if there's an associate dentist in your group that does it, is that a way for that associate dentist to be busier and help
You
the
know,
practice?
I call it procedural matching. When you come into a practice, it's so great if you can find what the owner does or what the group there does, and you do things that aren't what they do. For instance, if they need somebody to do endo and you love root canals, that's a way you could see so many new patients, so many people, and get yourself busy. Extractions, clear aligners, things that are a little bit out of the box that some dentists aren't doing. That's the job I would look for because that makes me needed day one,
And
keeping
I
their revenue and giving it to me.
And I
And
want to
that's
be
important.
clear, I have two practices. We have specialists in our practice, but we also refer to outside specialists and we also still work with the community. So we don't do every single thing in house. We don't take out impacted, horizontally impacted wisdom teeth. But what I'm going
Right.
to
We
share
don't
is
either.
there's only one thing a patient hates more than going to the dentist, Mark. It's
It's going
leaving
to
the
another
dentist they went
dentist
to go to another dentist, right?
and going
So
to another dentist.
so if
Exactly.
you if you have that opportunity, it's great. Now let's kind of shift gears a little and talk
Yep.
about hygiene programs.
Love
And
it.
I don't think we learn enough about this in school. I don't think we value that as enough. Sometimes it's looked upon as, oh, that's not profitable or productive. So kind of give us your take on, how can dentists approach them, so identify opportunities for comprehensive care, cosmetic dentistry, and more.
Yeah, I personally feel like hygiene has so much more to give than just scraping teeth. For instance, I mean, we have a business within a business. If you're a doc in a box, I had dinner Saturday night with a dentist and a wife and his wife, two friends that are totally different than me. Small town, almost rural farm area, sees about six, seven new patients a month, if that much. He does everything. His hygienist is the world to him. She has a separate business, brings in and recares all their patients, and calls, they're making appointments with Betty, not for hygiene. But hygienists also, they really galvanize the staff. I believe that I've seen great hygienists are sort of the bridge. They're not only a producer, but they're also part of the team or part of the
Yeah.
staff. And I think a good hygienist could be great. A bad hygienist could be miserable and could be very devastating to a practice. But in a positive note, when you get a hygiene program that is humming, that is annuity money. That's a
Yeah.
doctor who's making money without his hands working. And when I see a hygiene department, when I'm looking at a practice and I see a hygiene department that's humming and busy, and I see a doctor that may be a little trickling, I have to question the doctor's treatment planning ability, but that engine in hygiene, that's the future production in this practice. And that's what I look for
Totally.
first.
I'm totally
Yeah,
with you. Well, I want to ask a few bonus questions for a wrap up. You've trained
please.
a lot of dentists. So let's pretend I'm a dentist. I'm going to work in your organization. I'm an
Yep.
associate dentist. I'm motivated. I got my own column of patients. I got to check hygiene. Give me some tips. One of the things I find challenging is that how do you go check a hygiene patient? They need comprehensive care. Now you got to get stuck in a 12-minute conversation. And over in your room, you have something going on. How do
Yep.
you train your associate dentist to be efficient, but still thorough with their hygiene exams and keep everybody on time?
I love your questions.
Thanks.
So, number one is going to be you got a great team that you got to train because patients could get lost for 6, 7 minutes in a nice, upbeat conversation. The second thing is in dentistry, we were blessed not only with recalling our own customers, but we were blessed with natural stops during a procedure. And I really benefit from those stops. For instance, you want to check a hygiene patient that you know is a light because it's a recare. You get the patient numb, you say, Betty, I'll be back in a minute. You go check Mary in the hygiene room. The assistant is taking an impression to make a temp. And by the time they're done, you're in. You
Yeah.
prep, you're prepping your tooth. By the time, if you're working with FDIS, you're out, you're examining, and you're treatment planning another patient. If you have to move patient one into another operatory to discuss care, they'll wait 10 minutes till you're ready to that next step. What you have to do is look at a procedure, and I used to map this out, and I would map this out. I would get this patient, this patient, this patient would be done. So through the procedure, whether you're doing a crown, a root canal, there's x-rays, everything we do in dentistry has what I call natural stops. Utilize those natural
I love it.
stops to get into the hygiene. And remember, hygiene is your engine. Don't
I
keep
love that.
maybe
Also,
that.
these natural, that is such valuable advice for my audience because if
Thank
you miss a natural stop, you could throw the whole thing off, right?
you.
So
Right.
use these natural stops to go in and check hygiene. Well, you've been so
Listen, you got to take an x-ray. You got to take this. You want to check a bite, use it. She's scanning, use it. And when
fantastic.
you're using it, you're very productive because you're busy.
I
Thank
love
you.
that. Well, I always ask people this before I ask you this kind of final question. I want to share with my community. If you want to get connected with the amazing Dr. Marc, listen to his podcast, find out
Thank
more about him. You're going to text MARC to 215-798-9897. You can also reach out to us at dentistjobconnect.com. But I like to ask people like this, superheroes of dentistry like yourself, this
Thank you.
question, but I'll go first.
Good.
What do you wish you did sooner in your career? So I will authentically say to you that I wish I paid more attention to insurance adjustments sooner in my career. I was way ahead of the game with hiring management consultants. I was very into customer service and very into production. Oh, we can do implants and we can do this. But just like how you can't out exercise your diet, I did not pay enough close attention to the numbers related to insurance adjustments, and I regret that. I wish I could go back in time and do it. Now, you tell us something for our audience. What do you wish you did sooner
You
in your
know, I'm
career?
going to tell you something personally. I preach that we should learn 5 modalities to be great comprehensive treatment planners. And like you, I had specialists in my office, but I never placed an implant. And the one thing I can honestly say that I regret more than anything in my career is that I didn't place an implant because I had too much respect for the people that worked for me. That if the owner was placing implants, how does that look to a specialist who's dragging their butt over to work in my offices? It's something that I regret. I see people that are pros type of surgeons, and I regret that. But I'm not going to let it dismay my belief and my
Yeah.
preaching of we should learn implants. I had some really good people, so I did the insurance adjustment early on. And but other than that, I really think it was something I would have benefited a lot. I would have loved. And I think if that's part of, like, some ball players, to your analogies, Julius Erving didn't make the money that LeBron made, right? Or
Yeah,
Michael,
very true.
because he was
Dr.
born
J,
in a different era. He
yes.
also couldn't shoot. But anyway, let's leave that alone.
Well, I love Dr. J. It's a great note. Well, thank you so much for sharing with our community. I truly appreciate it, Dr. Mark.
Paul, you are great, and you're doing so much good, and we thank you, and I thank you.
Really appreciate
Be
it.
well. Thank you so much.